The thesis titled Associations Among Gender Stereotypes, Body Dissatisfaction, and Weight-Related Behaviors in Young Women was conducted by Kimberly Riley. Physical activity is recommended to all Americans to help improve their overall physical health and well-being. The recommended amount of physical activity for adults is 150 minutes to 300 minutes of moderate intensity activity a week, or 75 minutes to 150 minutes of vigorous intensity activity, or a combination of both forms. However, about 80% of adults are not meeting these recommendations set forth by the physical activity guidelines. Due to lack of physical activity, adults are more at risk to be overweight or obese and more likely to get chronic health conditions. Inactive adults are also less likely to benefit from the positive psychological health effects, such as a more positive body image, increased self-esteem, reduced anxiety, and depressive symptoms. Sedentary behavior is characterized by sitting or lying down with a metabolic rate near resting values. Rates of sedentary behavior are very high in the US and have become a public health concern due to its health risks. These include the risk of all-cause mortality and increase in cardiovascular disease in adults. Previous studies have shown that females are less active than males, with some studies observing this disparity as early as childhood. There is a decrease in physical activity for both males and females beginning in adolescence. However, the age-related decline in physical activity is more pronounced in females. By young adulthood, females are less likely to achieve the health benefits of physical activity because of their lower activity levels. Contributing factors of low activity levels include lower levels of competence and self-efficacy and gender appropriateness. Females may become less active because different types of physical activity is considered too masculine or too feminine, or they are not confident in their skills. Physical activity is also considered an important factor in the prevention and treatment of mental health issues. It is associated with a more positive body image and self-concept, which includes appearance evaluation, such as size, shape, and muscle tone, along with body esteem. In addition, research has found that women who witness or are subject to an act of sexism often report higher levels of body surveillance and shame, which demonstrates the negative effects of gender norms on their psychological health. Sexism is prejudice or discrimination based on gender and typically against women, and is considered a reflection of hostility toward them. There are two types of sexism, hostile and benevolent. Hostile sexism is the more familiar term, and it means sexist antipathy toward women. It is the more obvious form and often not accepted. Benevolent sexism is defined by Glick and Fisk as a set of interrelated attitudes toward women that are sexist, especially in terms of restricting women's roles and viewing them stereotypically. This form is not as obvious and therefore often overlooked because of its subtle and more positive nature. There are three sources of male ambivalence in benevolent sexism: paternalism, gender differentiation, and heterosexuality. These constructs are rooted in the idea of domination, affection, and protection, and women are viewed as incompetent adults who need a male figure to depend on. Ambivalent sexism, as Dumont et al. Demonstrated, can shift a woman's self-control and autobiographical memory. Autobiographical memory for self-competence was evaluated, and the results showed that benevolent sexism comments led to more intrusive thoughts during the task and the feeling of being incompetent. Having a more negative view of oneself and a shift in personal memories can have a detrimental effect on work and academics. Women will feel incompetent and inferior while performing tasks because of intrusive thoughts brought out by benevolent sexism. The goal of the study is to identify in young women the association between the endorsement of benevolent sexism constructs and body dissatisfaction and the moderating effects of physical activity and sedentary time. We hypothesize that benevolent sexism will be positively associated with body dissatisfaction and sedentary time, and negatively associated with physical activity. Body dissatisfaction will be negatively associated with physical activity and positively associated with sedentary time. And the associations between benevolent sexism and body dissatisfaction will be attenuated in individuals meeting physical activity recommendations for moderate plus vigorous physical activity, compared with those who do not meet the recommended amount of physical activity. A cross-sectional online survey was conducted in which N equals 170 women. The age range included 18 to 35-year-old females, and we used Qualtrics online software. Participants were recruited by sending the screener link to personal contacts along with online via Facebook posts and Instagram advertisement. This thesis is part of a larger study which is ongoing, so the data used for this thesis was the first N equals 31 respondents. There were 5 components of the online survey, which include the demographics, ambivalent sexism inventory, international physical activity questionnaire short form, screen media usage questionnaire, and the body dissatisfaction scale. The demographics section included questions regarding standard demographics, including the participant's sexuality, which was collected because heterosexuality is one of the constructs of benevolent sexism. The Ambivalent Sexism Inventory, or ASI, is a 22-item tool that measures one's endorsement of 2 different components of sexism, hostile sexism and benevolent sexism. There are 11 items each with a 6-point Likert scale that ranges from 0 to 5. The higher score indicates greater endorsement. The International Physical Activity Questionnaire short form, or IPAC, asks the participant questions relating to physical activity and sedentary time in a usual week, and has different categories that include vigorous physical activity, moderate physical activity, walking and sitting, and the intensity weighted minutes per week are calculated. The screen media usage questions ask the participant the usual time they spend sitting or lying down using screen media, which includes a variety of screen usage during the weekend and weekday, such as time spent on social media, the computer, or cell phone. The body dissatisfaction scale asks respondents to identify ideal and perceived actual body shape from a pictorial scale to assess body dissatisfaction, which includes 9 bodies of different body types. This table shows the data from the first n equals 31 respondents, which includes the percentage or the median and standard deviation for each of the categories. The mean age of the females who completed the survey was about 24 years old, all of whom identify as a woman. About 48% of the respondents are from Massachusetts, another 48% are from other states, and about 3% are from outside the United States. About 87% of the respondents identify as heterosexual, about 10% identify as bisexual, and 3% preferred not to answer. The mean BMI was 26.4 with a standard deviation of 6.7. This box and whisker plot is looking at the association between benevolent sexism and body dissatisfaction. Group -1 are the women who would like to have a body size slightly heavier than their actual body size. Group 0 are the women who do not want to be heavier or thinner than their actual body size. And group 1 are the women who would like to have a thinner body size than their actual body size. R equals -0.24, the Kruskal-Wallis test p-value equals 0.13, and the p-values between the -1 group, 0, and 1 groups suggest that women who would like to be slightly heavier may report greater endorsement of benevolent sexism compared to the women in group 0 and 1, who chose their actual body type or a thinner body type as their ideal size. This scatter plot is looking at the association between benevolent sexism and moderate and vigorous physical activity. R equals 0.44, and there appears to be weak associations between the 2 variables. This box and whisker plot is looking at the association between vigorous physical activity met minutes and body dissatisfaction. The Kruskal-Wallis p-value equals 0.009. Therefore, this p-value in the contrast suggests that there is moderate negative association between vigorous physical activity and body dissatisfaction. It appears that the women whose ideal body weight was slightly heavier, group -1, have higher levels of vigorous physical activity, and women who reported their ideal body weight was thinner, group 1, reported the least vigorous physical activity. The moderating effect of physical activity on the association between benevolent sexism and body dissatisfaction was tested by calculating the median split for total minutes per week of moderate and vigorous physical activity, and looking at the association between benevolent sexism and body dissatisfaction for those below and above the median level of overall physical activity. Due to the small sample sizes in each group, it is difficult to make any solid inferences on the moderating effect of physical activity on the association between benevolent sexism and body dissatisfaction. However, it appears that those who would like to have a body size slightly heavier, group -1, n equals 2, and were above the median level of total moderate plus vigorous physical activity reported greater endorsement of benevolent sexism. Women whose ideal body weight is slightly heavier than their actual weight have higher levels of physical activity and reported greater endorsement of benevolent sexism. We can infer that this is because of society's standards for women being thin and more feminine. The women in this group who want to be slightly heavier than their ideal weight may want to be more muscular, but because of the benevolent sexism attitudes and comments that they are instead more active and try to pursue society's ideal body of being thin. This thesis is part of a larger research study that is ongoing. Therefore, the sample size is small and not too diverse. The sample data used in this thesis included participants who mostly live in Massachusetts, so having a larger and more diverse population will help provide more accurate results. Using accelerometers and a sample to provide more accurate physical activity data rather than relying on just self-reported data will also help or give us more results. In addition, having a focus group that involves talking to participants more in depth about their thoughts and experiences dealing with these topics can provide more useful qualitative data. Thank you, Dr. John Serrard, Dr. Katie Potter, and Milana Cox for the support, along with the Commonwealth Honors College for the funding of this thesis.